Sarah Showman. I'm a veterinarian at All Pets Hospital in Grand Forks. And I'm just going to talk to you guys a little bit today about what it is to be a vet and how I got to where I am. So first, schooling. After high school, it takes a 4-year undergrad degree. Most students do that in animal science or some kind of science field, but you can really do it in whatever. There's just certain prerequisites you have to take to get into actual vet school, which is 4 years after undergrad. And so each school kind of has its own prerequisites, so that's something you want to start looking into when you start thinking about applying to vet school. And so some vet schools around North Dakota, the closest one would be the University of Minnesota in Minneapolis, and then there's also schools in Iowa and Kansas, but then they kind of start to spread out. I went to school at Oklahoma State, which is in Stillwater, Oklahoma. So some other things that it takes to get into vet school are a lot of the schools look at volunteering, so doing volunteer hours with animals or even just the community, things like that. Other things they look for are jobs in the veterinary field, whether that be an actual job or doing job shadowing. And then they also, some schools look into research, so looking into research opportunities when you're in undergrad is a really good idea, especially that anything has to do with your science classes. All right, so what I do is I'm a small animal vet, and I work with mostly dogs and cats. At our clinic, we sometimes see other small mammals and sometimes birds. We also have a mixed animal vet who works here, so he works with cows, horses, goats, pigs, kind of anything that you would find out on the farm. And then he also does cats and dogs when he's in the clinic. So those are kind of two of the major things you can do as vets and what most people think of when they go to vet school. But we also have vets who work in research, in food development. There's also some vets that work in human medicine, so there's a ton of things that you can do with your veterinary degree once you get it. It's not just necessarily working in a clinic. Also, some vets now can specialize, so you can specialize in radiology or surgery, to work at a university or work in a specialty center, kind of anything like that. So those kinds of different, so how spread out all of those job opportunities are kind of depends on your pay. So average salary for a vet is really anywhere from probably about $60,000 starting to $150,000 or so, and that would depend on how much schooling you did. If you decide to specialize, those are usually 4+ years after your vet school degree, so you're in school for a very long time. And so kind of why I decided to be a vet, I've always been the one to bring home the sick cat that I found at the barn or, kind of anything like that. I've always loved animals. So it kind of just made sense for me. I've always loved the medical field and, learning about how the body works and all of those things. So just kind of was a good fit for me. But it is a lot of work. I do love my job, but there's definitely things that are more difficult and some things that I love to do. Like I love to see all my happy, healthy patients all the time, but sometimes when there's sick patients and you have to deal with finances, with owners, things like that can get really difficult sometimes because we want to do what's best for our patient all the time, but they do cost money and a lot of money sometimes to do those things. So it's something that you have to consider. Going to vet school and getting your veterinary degree doesn't mean that you get to not like working with people, because our patients all have a person and you have to be able to work with that person, because if you can't, then you're not going to be able to treat your patient. But yeah, I think most of my favorite things are just seeing my happy patients every day. I love their families. Getting to know all their owners is definitely something that I enjoy. So I think we'll show you kind of how we do just a simple physical exam and kind of what we learned from that. And then we'll give my friend here, Leo, some vaccines. And I think that'll be it. Ready? Say hi, Leo. Okay. So a physical exam is something that we do for all of our patients when they come into the clinic. It may look simple and quick to owners, but we do learn a lot from everything we do. So I'll just kind of talk through what I'm examining while I look at him. So what I do is I always start at the face and work my way backwards. So everything we do first is checking the eyes, so making sure that their cranial nerves are intact by looking at their face, making sure they can blink, looking for symmetry in the face, that they can, move all of the muscles in their face, and then making sure that they can actually see. So kind of just acting like you're gonna throw something at their face or tap their face, their automatic reflex to blink says that they can see what you're doing. Then checking their mucous membrane color so that they're nice and pink and that it refills in 2 seconds means that they're normal hydration and they have good blood pressure. Checking all of their teeth to see if they have any dental calculi, anything like that. Making sure that we look at both sides of the face. Then checking all of their lymph nodes, so making sure that their lymph nodes are soft, not enlarged or anything like that. So they have lymph nodes right behind here that you can palpate and then right up in the shoulders. Giving you a nice little massage. Oh, and I need a stethoscope. So I'll swing around to the back. So then when we listen to the heart, we listen to different places on both sides of the chest, and then listening to the lungs, we listen to all the lung fields. So making sure that we don't hear any murmurs, any arrhythmias, which are differences in the sounds of the heart. And then listening to all of the lung fields, making sure that they don't have any crackles or wheezes, anything that would sign that they had pneumonia or anything else going on in the lungs. So I'll just take a listen to them quick. And then as you're going along, just making sure that we're running our hands over them, making sure we don't feel any masses or lumps or bumps, anything new. And then when we palpate their abdomen, it's making sure that we can feel all of the normal organs that you should be able to feel. So you can feel the kidneys up here, you can feel the liver, and then just making sure that kind of in between the intestines all feel soft and you can move them around. There's no lumps or bumps that you can feel inside the abdomen either. And then checking the femoral pulses down between the legs. So that's where you can feel the heartbeat technically through their vessels in the back of their legs, making sure that that feels symmetrical and that you can feel both of them well. And then checking these lymph nodes back here and making sure that they're symmetrical and soft again. And then always just making sure that the anus and any of the reproductive organs look okay. And Leo today looks fantastic, so we'll give him some vaccines. So another part of being a vet is public health and keeping all of not only our patients safe, but our families safe. So vaccinating for rabies is kind of our number one. Rabies is transmitted through a bite, so the saliva of an infected patient. So we always vaccinate our patients for rabies because it can be transmitted to humans. So it's just a simple little poke. The next one we'll do is for distemper and parvo. So parvo is a highly contagious disease between dogs, and that's one that we don't want to spread between our canine population. So the next one is lepto. Lepto is transmitted through urine, and lepto also can be transmitted to humans. So we want to make sure that we vaccinate our dogs for lepto so that they don't get that and transmit it to their owners. And then the last one is Lyme vaccine. And Lyme vaccine is for Lyme disease, which is transmitted through ticks. So it can't be transmitted to its owner, but can be transmitted from dog to dog through tick bites. And the last one is for kennel cough, and this one they don't always like because it has to go up their nose. But this, I know, good boy. But kennel cough is transmitted from dog to dog, like at the dog park, groomer, kind of things like that. So that's, kind of our simple physical exam, but we do gain a lot of knowledge from that exam in keeping our patients healthy.